Welcome back to Angel Winnie Nursing tutorial. In this video, we are going to study about the barriers of effective communication. So here, there is a lot of barriers we can see in communications. Barriers means it's nothing but which will be distract or the stop or it will be disturb the communication. So here we are going to see some of the barriers which will be disturb the communication. In which the process of communication, encoding, transference, and decoding, there may be possibility of interface. It may be hamper the communication process. This is known as noise. So we can call it is noise. Noise, if comes means we couldn't hear the communication properly. We couldn't understand what they're saying. That is the thing. It is the, just like carrying water in a leaky bucket and the barriers also the major difficulties during the message transfer. To ensure clarity in communication, barriers must be eliminated and minimized the barriers are. So here we should be eliminate or the we should be removed the minimize reduce the barriers, then only we can achieve or we will get the effective communication. So let's see the barriers of communication. Here we will see the some of the seven barriers of communication. These very important barriers. First one is the environment. So what is the environment will do? Yeah, definitely. Environment will be the noise is a basic barriers in the type of environment of communication. Yes, the noise if is here means if we couldn't hear we couldn't hear what the person is saying or the patient is saying. So these all the things why we are studying the communication here means here we are communicating with the patient. So we need more communication, more information. So what the patient is saying, it should be loud. And what the nurse is saying to the patient, it should be loud. Then only they can understand what we are saying or what others is saying. Okay, so first one is the environment. We have seen that noise. And second one is the channel. Channel means is a fault. So as you know, what is a channel means is a medium. So we were using the medium. Here is a faulty tax machine, a crackling phone, or illegal hand, handwriting, and can be the barriers of channel communication. If you are not written properly, the patient or the others is not able to read. So that is a poor communication. It's not effective. Then crackling, the phone sound, so the machine sound. So you are saying something, this drugs has to be given this patient. You are telling to your colleague, it's not hearing properly. What will do? So they are not getting the information. There will be the poor communication. That is a channel. Next one is the receiver's attitude and behavior. So receiver means as you know, who is receiving the information. The sender will send the message to the receiver and receiver means it will be receive the message. And receiver attitude is very difficult or the attitude and behavior is different. The type of occurs basically when organization is is to satisfy its clients, it can lead to inaccurate hearing of information. So when the organization is satisfied its clients, yes, we are the nurses will provide the care according to the satisfaction of the patient. It's not for the satisfaction of the nurses or the hospital. And we need to make the satisfaction of the patient so it can lead to inaccurate hearing of information. So the attitude is very important. And the next one is the transmission journey. There can be some difficulties during the transmission journey, so it is necessary to repeat the message and use more than one channel to communicate the message. Yes, obviously, the doctor or the nurses or the doctors, yeah, especially the doctors means they will say, the nurse, you have to give the IV infusion to the patient. So he will say verbally. So the nurse is forgot. And what will do that again, the doctor will be right on the this one doctor's note has to be give the IV with this medication, whatever. So here there's a two channel they are using, one verbal and second is they have written. So that is a two channel. The transmission journey they can change and it may effective. It won't be effective. They can use the two channels. Next one is the lack of planning. Lack of planning means that the purpose to communicate with the person should be very clear. So planning is the most effective thing in communication. Yes, obviously. So planning. So first of all, you have already studied that assessment, planning, all these things. Assessment, then goal, and you will plan and you will implement. These all are the things you have studied. Okay, so what is that here? So planning is very important. Whatever we are going to do, so before that we will plan. Yes, what we need to give. So we give in the sponge bar, we give the IV infusion, we give the injection, whatever, we will plan and which will help for the effective communication. And next one is a semantic distortion. Then the distortions comes in the use of words. It may be serious barriers to effective communication. So maybe some of the barriers that use of that words is it may be serious barriers. It's because of that is communication will be won't be effective. And last one is the linguistics and cultural differences. So here it create a problem for the receiver to complete or understand the language used by the transmitter. Yes, so basically the thing it is, the patient is comes is Arabic patient. Yeah. So some people, they are out of India. They will come and take the treatment from here, India. So they are maybe Africans. I mean, this one maybe Arabic. Those people only know this specific kind of their local languages. So what we'll do? So nurses doesn't know to how to communicate with this. So the transmitter will be there. They will communicate. What are the things nurse want to tell to the patient? The nurse will tell to the translator. Translator will be translated to the patient. So that is the linguistic and cultural difference. According to their, we are giving the more importance and priority to the patient. So this is a patient-centered care, and the communication is very important in the patient care. Okay, so these all are the barriers of effective communication. We have seen here environment, channel, receiver attitude, behavior, transmission journey, lack of planning, and semantic distortion, and linguistic and cultural differences. So this is the effective sorry barriers to effective communication. So let's see here. So here they have shown that the barriers of communication is in a different way. That is in the two categories. Yeah. Look at this one. So that is first one is the physical. So under the physical, what are the things is coming under? That's the speech difficulties. Yes, that the first one is a speech difficulties and deafness, a noisy environment, poor sight, and poor cognitive skills. What is that? So physical barriers means the speech difficulties is there that they are having that stammering and that they are having some speaking problem, repeating the words, some pronunciation will be having problems, so kind of things. So that speech difficulties as barriers, that is a barriers. So that is a barrier. So they couldn't make the good communication. Deafness, the patient is deaf or it's not effective, and noisy environment. The environment is noisy, so communication won't be effective. This is a barrier. And poor sight. Patient or the this one nurses if it is not there in the sight, so that's a problem. And poor cognitive skills, it's understanding skills. Then emotional things will be coming under the perception. So what we perceive, what we seeing, that what we perceived in that. So that is the thing. And some people they have the prejudice before that we are they come to know that they will this will be like that. What will happen? We know like that they may have the prejudice. That is also one of the barriers and the fear, then aggression and threats. So these all are the emotional barriers will be coming under this one. Okay. So so this one based to the communication based on the individual attention. So this is according to the individual attention. Some are the barriers also they have given. So these are the effective barriers, barriers to effective communication. So barriers we have seen that physical and this one emotional we have seen. Next one some of the internal barriers, external barriers, and what are the things is physical barriers, system design, all the things will be coming under that. Then attitudinal barriers, ambiguity of the words or phrases, and individual linguistic ability, presentation of informations. Okay, let's see all these things. So here, internal barriers means they are the fatigue, poor listening skills, attitude towards the sender and the information, lack of interest in the message, uh, fear, fear and mistrust, past experience, negative attitude, problems at home, lack of common experiences and emotions. These all the these things will be coming under the internal barriers, barriers which is internally. So patient may have fatigue, they will feel very bad and feeling poor listening skills and attitude towards the sender they doesn't like they don't like the people then information, lack of interest of message, and fear, mistrust, the past experience. Because of that, these all those things will be coming under the internal barriers. What is the external barriers? It includes noise, yeah, obviously. So these internal means which affect them personally. Yes. So external means the surroundings. The external barriers is the surroundings like noise, distractions, email not working. So email is not working, the message won't be come. So they are sending that refer the patient in the ICU to the ward. So they send the email to the this one system wise. It's not working the email. So what will happen? The communication won't be effective. It's a barrier and the bad phone connections, they called and it's not pick up, but the communication is not there. So it's the barriers of communications. And the time of use too many technical words and environment. And the barriers keep the message from getting through when communicating. Watch out for the barriers and monitor the actions of the receiver. Watch her body languages. Check to measure message the receiver as is one of the send and ask questions and listen. Okay, so external barriers, there is a lot of things. Noise, distraction, email is not working, so all the things and barriers keep the message from getting through. And when communicating, watch out the barriers and external barriers. They should make sure that the receiver, those who are hearing, should understand the message or should understand what the sender is saying. Okay, so that is the external barriers. Next, move to the physical barriers. So as we have seen is above is the physical barriers, and now we are going to see the physical barriers are often due to the nature of the environment. Definitely. Thus, for the example, natural barriers is exist if the staffs are locked in different building or on different sites. Likewise, poor or outdated equipments and particularly the failure of the management of introducing the new technology may also cause the problem. And wishlist distractions like background noise, poor lighting, and environment which is too hot or cold can affect the people's morale and contraction, which instead interference with effective communication. So physical barriers, the first one is nature is a physical barrier. And if they're in the different building, so how they will communicate it? Definitely the phone calling, they will call. So that is pure communication. If it's there means they couldn't call and the technology is very weak. This cause problems, distractions, background noises. So these are the physical barriers and system design. System design means here that system design fault refers to problems with the structures and system is placed in an organization. For example, this might include an organizational structures which is unclear and therefore make it confusing to know whom to communicate with them. Other example could be inefficient and inappropriate information system, the lack of supervision, training, and lack of clarity in roles and responsibility, which can lead to the staffs being uncertain and about what is expected of them. So here, system design, there is no control, lack of control. Then what is lack of supervision? Then so they doesn't know how to do that procedure or the how to maintain the system. So these all will coming under the system design. The next one is the attitudinal barriers. There's a lot of barriers. Attitudinal barriers means here the barriers is come about a result of problem with the staffs in the organization, their attitude, staff's organization attitudes, and these may be brought about, for example, by such fact factor as poor management, lack of consultation with employees, personality conflict, which can result in the people delaying or confusing to communicate the personal attitude of individual employees, which may be due to lack of motivation, dissatisfaction at work and brought about for the insufficient training to enable them to carry out particular tasks or just resistance to change due to the entrenched attitudes and ideas. So here that we know the people are within the society as we know their very attitude sitting in the hospital, so they will have the attitude staffs problem with the staffs in our organization. They may have the attitude poor management because of poor management, lack of consultation, employees with personality conflict. The conflict means the problems, crisis, the fights, everything will be there. So that is the attitude in the conflicts. May delaying, they refusing to communicate. So some are they are not mingling, they're not speaking, they will delay, they won't sell. So they want to give the treatment to the patient, they're not given this all the things is what will say that handover. So shift wise, this one their duty will be 6 hours, 8 hours. After this, their shift they have to hand over what are the procedure, what they done to the patients is hand over to the next shift. They're not speaking and they won't give the proper communication. They'll write and go, whatever it is. So that is the attitudinal barriers. Then ambiguity of words or phrases. So words sounds like alike but having different meaning can convey a different meaning together. Hence, a communicator must ensure the receiver receive the same meaning. It would be better if such words can be avoided by using the alternatives. So health we will be writing the example I can say that health we will write here H2 health we will write or we will write someone will write H2 like this. Okay. So that is a misreading. Someone will be saying this H2 hydrogen. So someone will be right hit. So like that is like calling something like the words. So they are saying the name of drugs. So you know ceftriaxone, ceftriaxone. So a lot of drugs will be there. Or they saying the words is same like that, but they given the different drug. So that is a mixture of the words and phrases. Kind of thing they have to avoid, otherwise the communication barriers will occur. And as to an individual linguistic ability it's also important. The use of difficult, inappropriate words in communication can prevent the people from understanding the message. Poorly explained or misunderstood the message can also result in confusion. We can also think the situation where we have listened to the something explained which we just could not be grasped. Yes. So that this one. So you guys knows that we are using as an as we will be using the terminologies in the hospital. Terminologies means nothing but it's the medical terms we are using. So for that, this one bluish discoloration. So what is color changes? We said that is cyanosis. Yes, right. So kind of things is like a lot of terminologies will be there. So which is very you are not understanding or that this one will we say that the message is not understanding, communication will be affecting. So which is understanding the way has to be, they have to tell the message to the center, sorry, to the receiver. The last one is the presentation of information is important to aid understanding. Simplify put the communicator must consider the audience before making the presentation itself. In cases where it is not possible, presenter can at least try to simplify his or her vocabulary so that the majority can understand. Yes, vocabulary, the way speaking, that's one. Simply they are speaking and others is not understanding that the communication won't be effective. What they're saying that listener or the receiver should understand them, understandable. They should understand. They should what receiver will give the decoding feedback to the sender. So these all are the barriers we have seen here. Okay. So next we are moving to the methods. What are the methods of overcoming the barriers. Okay, so anyway, the methods will be there, some of the methods. So how we can, this one, what will we say that if how can overcome the barriers? So here, the communication process falls short of its goal unless decoded message has the same meaning for the receiver as did the original message for the sender. Application of one of the principle may develop more effective communication process. So first one here is the method of overcome the barriers of communication is first one is to identify clearly what is to be communicated. Yes, obviously they should understand what they are going to saying that what they are there to communicate. And is it worth taking the time to establish a goal, to think what one wants to say, and to formulate the message carefully? The information, what we are going to do, that communication, it should be, they should think that is it effective? Is it saying correct person, correct way, and formulate the messages correctly? So, for a long thing, we are saying that for telling the story instead of that, they can say in one word. So, like that is a worth. Next one to set the climate according to the goals-oriented interactions. Climate include the factors influence the physical, emotional, environmental in situations that surround the interacting person. Recognizing the factors within the situation adversely affect the communication is the basic for the actions by the sender of the messages. So seek out the climate. Okay, climate is here. What is mentioned that is a physical, emotional, environmental situations. So the hospital, how the nurses and doctors should be, it's very professional. It should not be silly, very happiness. It's not like that. Should have the professional manner, and they should speak in a polite and understandable louder, and it should have the manners to formal manner to maintain their attitude. So here, according to that, the physical, emotional, environmental situation, they have to convey their message, convey the communication, or maintain the communication. For example, it's a noisy environment certainly distract the communication process. So what will do? If you guys are going to say the going to say the this one message or the information to somebody, there is too much noise. What will you will be wait for to stop the noise, and then you will say that. Okay. So the situation is very important. And the third one is choose words calculated to convey the message accurately. Avoid technical abstract words or words with more than one meaning that have to be misinterpreted. Choose familiar words and use them correctly. Yes, obviously. Use familiar words and say in short way. Okay, so yeah, I know the staffs and the people, normal people, they will talk one whatever they are telling, so it will be big stories. Instead of that, as a professionals, we should speak very less and should say complete the things what we are going to say, and in the polite and this very short way, they have to convey the message. Avoid the technical abstract and use the terminologies which is understand by the staffs. And this fourth one is the consider the other individual and his possible reaction to the words and choose them for the message, his cultural background and lifestyle, attitudes and needs such that the message is apt to be perceived. So individual and his possible reaction to the words and choose the message. If they understand, they will show the yes, I understood, or they will say the code or the feedback, the cultural background, lifestyle, attitude according to that. So some of the culture they may having that hearing the covering their head within. Some Muslims, some Sikh are those people they having. So according to the culture, we should respect the culture and convey the message. It's not simply we should say all you have to remove all the things. It's, like forcefully, if you're saying this, they won't allow. So we should respect them. We should say them what is that procedure, what why we are saying all the things. Okay, give the priority to the patient. And fifth one is be aware of non-verbal communication being transmitted. The meaning of the message may be altered by tone of voice and inflection, facial expression, gestures, and other body movement. We should avoid the non-verbal communication. Can you tell me that non-verbal communication? Obviously. So verbal means we are telling, non-verbal means we are showing the expressions, the facial expressions, right? And gestures and this one, eyes looking like the rude, we are looking at them. So these are the non-verbal communication showing the signs. This one, what will it be? Signs and hand signs. Okay, so these are the things that we should avoid. Forgetting that proper communication is to say that what verbal, okay, to say or to write, not use a non-verbal communication. Next one is the sixth one, the time the message to coincides with the point of most likely resp respectability on the part of the other individual. Time managed to coincide with the point. And seventh one is the wait for the feedback. Obviously, we should wait for the feedback. Then only we will understand whether the center understand or not. The verbal and non-verbal will give clues regarding the accuracy and transmission and the interpretation of the message. And the next one is a listen and observe without interpreting. And ninth one is a look for implied meaning of the other individual while trying to understand his or her point of view. And next one is evaluate the effectiveness of the communication process in achieving the intended goal. So these are the things will be coming to this one. So first one is a wait for the feedback. Once they were understood, we should wait whether they understood or not. Listen and observe without the interrupting. They should listen and observe it. Look for amplified meaning and evaluate the effective communication. So these all the things will be coming under for the methods of overcoming the barriers of communications. Okay, so this is about the this one methods of communication. So I hope you guys you understood a little bit. If you have any doubt, you are not understanding, or my lecture is not conveying properly communication, which is not communicating properly, just say the feedback on sorry, on comment box. Definitely. So I will change whatever you want to say me. And this one, I'm going to stop here. And next class, I will be continue the next video. And thank you for listening, all of you.